Hello, and welcome to Actuary Voices. I'm David Nolan, the Director of Communications at the American Academy of Actuaries. I'm joined today by Julia Lerche, who's a member of the Health Practice Council, Chair of the Medicaid Subcommittee, and a member of a host of other Academy committees, subcommittees, and task forces. Julia, welcome to Actuary Voices.
Thank you. It's a pleasure to be with you.
Why don't we start the conversation with a little bit about you, your background, and work our way towards your path to becoming an actuary?
Wonderful. So I grew up in Northern Virginia, and as a kid, I was extremely introverted. I loved puzzles and reading books into the wee hours of the night, playing music, first piano and then flute. And of course, I loved math. I had a family friend who wrote math books. That was his job for schools. And for a long time, when asked what I wanted to be when I grew up, I said I wanted to write math books. Probably an odd profession compared to most kids, but that's just who I was. So I love math and reading and music. In high school, I had the privilege to attend a program called Program in Mathematics for Young Scientists called PROMISE. It was a 6-week math camp at Boston University where high school students came together and learned number theory. And looking back on it, it really was just such a privilege to be able to have this opportunity as a kid. It was the first time I was really challenged in math. I'd always loved math, but never found it to be quite challenging in school. So it was the first time I was really challenged, and it was just amazing. It was really life-changing. I spent 5 summers there, 2 as a student and 3 as a counselor. And that's where I was introduced to theoretical math, people who worked in academia, and this concept of thinking deeply about simple things, which is something I've really just carried with me throughout my life. Thinking about simple problems, different ways to approach it, and just really understanding the core of an issue before tackling it. Because of that challenge and joy that I felt from that math camp experience, when I went to college, I studied theoretical math, thinking that I would go on to get my PhD and join the world of academia, just like my math camp counselors did. And over the course of college, though, I watched others going through that process of applying for a small number of graduate spots in theoretical math, and I decided to pursue a different path. I also wanted something that was, I could talk about with friends and people would understand. So I decided to take a job as a pension actuary. It's really great conversations for over dinner with friends. But it was really my mom who put the idea of being an actuary in my head. She had read something somewhere about the actuarial profession being a great place to be and encouraged me to look into it. And so while I was in college, I decided to take the first 2 exams. I think they were maybe at that time in calculus and statistics. And so I took those first 2 exams, and I applied to a handful of consulting jobs, one at an actuarial firm and one at a management consulting firm. And I got the actuarial job and I took it. And so I started out in pension consulting, and that's where my actuarial career started.
So you started as a pension actuary and are now a fully fledged health actuary?
That's correct. Yeah, so I took that pension job. It was in Boston. And since then, my career has taken a lot of twists and turns. So not to knock on pension actuaries, but after about 2 years working in pension consulting, I was terribly bored. And so I left that job and moved into health benefits consulting, thinking that it would be more dynamic, and it was. So I changed consulting firms. I was still in Boston, and moving to the healthcare space. That's the job where I really developed as a as a professional. I feel like I had a lot of opportunities to develop a broad skill set in that position. I had some really amazing mentors, both actuarial and non-actuarial mentors, and I had the opportunity really to grow not just as an actuary, but also as a consultant. The actuarial work became more of a component of my job rather than the core of my job. And I had opportunities to work with teams with more diverse skill sets, growing my leadership and management skills. I was involved in selling new business and just generally had exposure to a broader array of work. And it was very exciting for me. So that's how I got into health. I think my career started to take a bit of another turn, maybe around 2004 after the Medicare Modernization Act passed. I had raised my hand to really dig into MMA and its impact on employers and develop intellectual capital around those employer impacts. And that was the first time I read proposed rules, which doesn't seem that exciting, except it was to me. And I traveled to DC and I got to hear from policymakers. And that's when I found my passion in public policy. I learned things like low-income subsidies and Medicare that I had never heard about before. And I just became really curious about healthcare outside of employer benefits and started to think about changing my focus. And that was, in the mid-2000s. And then not long after that, my husband and I moved to North Carolina. I got my FSA. I had finished my exams about maybe 2 years before I got my FSA. It took me a full 2 years to the time we had to write up summaries of professional development courses we had took. So we had to, attend meetings and all that stuff. And it took me 2 years just to do the write-ups because I was so wrapped up in the exciting work that I was doing. So I squeaked my FSA in about a month before having my first child and moving to North Carolina all at the same time. I worked remotely after having my daughter for a few months and then decided that I wanted to go back to school and leave my actuarial profession really potentially behind to move into a lucrative career in public health. So I applied to UNC Chapel Hill, just one school, for their master's program in public health, and I got in. And so I went back to school full time for 2 years and got my master's in public health at UNC. And it was another exciting time in my journey here. I was able to get out of the stats course because of my actuarial background. I don't think they even made me take a test. And so instead, in my very first semester at graduate school, I took a class in healthcare policy for vulnerable populations. And again, just a life-changing experience, eye-opening in terms of really, the haves and have-nots in healthcare, and how the system works and doesn't work for a lot of people. And so that's kind of another really big milestone in my career path here. After I finished school and got my master's degree, I took a very non-actuarial job with the state's, here in North Carolina, Office of Rural Health, where I worked on a HRSA grant to implement a pilot health coverage program for low-income parents in a few rural counties in North Carolina. This was back in 2009, which was a pretty critical year. It was before the ACA passed. And while the work in itself and the job didn't really challenge me as much in the ways that I, really clicked with my skill set, I got to see how healthcare worked on the ground level. I visited safety net clinics, and it was just really eye-opening. So during that time, a few months or maybe 6 months after I started that job, ACA passed, and it really made the program I was working on not particularly necessary anymore, because at the time we thought Medicaid would be expanded in all states. It was assumed to be mandatory at that point in time. And so I raised my hand within the Department of Health and Human Services in North Carolina to say, I really want to focus on ACA, like get me in there. I want to help organize. I want to help evaluate what all of this means for our state. And it was just really a great opportunity. And then as part of that, was working closely with our Department of Insurance. And the DOI was tasked with really much of the ACA policy work around the marketplace. And that piqued my interest. So I got an actuarial job at the Department of Insurance. So I was able to pull it back together and work again as an actuary at DOI, where I help lead the ACA implementation work at DOI. I say it's an actuarial job. I think there was an actuarial component to it, but I really helped to lead our policy work in terms of the ACA marketplace. At the time, the Department of Insurance was tasked with developing out a state-based marketplace, which unfortunately we never implemented. And I was heavily involved in reviewing the rate review regulations and rate review processes. I got the opportunity to chair the NAIC rate review. I think it was a work group at the time. So I got to work with all people across all the states and CSIO, and it was so amazing. It was just really such an exciting time of change and working with people to try to make it work, both within North Carolina, but also thinking about it nationally. And, I got exposed to what other states were doing and just how diverse different states are. But we were all grappling with similar issues. So it was really, really fun. And then I think I've had a lot of jobs, so it's kind of a theme. Then things turned again. So in early 2013, our legislature decided to pull the plug on our state-based marketplace work. And so I decided to take everything that I had learned working at North Carolina DOI and go back into consulting. And so I spent a couple of years consulting with and really supporting other states on their ACA implementation. So taking everything that I had worked on and developed in North Carolina to other states to really continue the collaborative work I was able to do and continue to have that exposure across different states and the learnings that come with that. One of the great things about that was I went to work at an actuarial firm. And so I got to be around actuaries again, which is something, although there's a small group of actuaries at the DOI in North Carolina, it's different when you're in an actuarial consulting firm. And so it was great to have those interactions again as well. But after a couple of years, I really missed public service. And when an actuarial position opened up with the North Carolina Medicaid program in 2015 to support their transformation from fee-for-service to managed care, I just jumped on it. And like I did at DOI, I've really been able to mold the position into one that has included my passion for policy and my actuarial background. And it's just been a really rewarding experience.
I can see a reasonably direct line from where you started to where you are now, but it was a somewhat circuitous route. Though it is interesting what you say about North Carolina and public health. I know several people who are working in that field, especially around the Research Triangle, Raleigh, Durham, and Chapel Hill. But, as you mentioned, public service, and as we are talking on the eve of Public Service Recognition Week, I thought I'd ask you about your volunteer work at the Academy. What drives you to become such a great volunteer?
I think part of it is being in public service, and especially in my current position, I'm the only actuary. It's a place where being involved in the Academy committees is a place where I get to really share ideas and have kind of like-minded professionals to talk through some of the things that I'm working on in North Carolina or things that are rolling around in my head, which is a lot. And so I really enjoy the professional engagement that comes with it, as well as I think I bring a unique perspective to actuarial groups with my public health background, both with a master's degree and also working in public service and in health policy. And I just really enjoy looking at things from different perspectives and hearing the different perspectives of different actuaries. In the Medicaid Subcommittee, which I chair right now, we have a mix of actuaries from health plans and states and consulting actuaries. And we have really, really, really good debates. Sometimes they can be uncomfortable, but we somehow are able to find the actuarial professional common ground to be able to get to I think a real balanced place, which is exciting. It's it can be challenging to kind of cut through when people are coming at something from really two different sides, but really get to the core and the common ground. So I enjoy having the professional presence of actuaries, because not everyone always understands things that I say when I start to do my actuarial babble. So, and it's good to have peers to bounce ideas off of. I think that's something that I miss being in my current position.
Is there any group whose work you find particularly exhilarating or challenging?
So I'm trying to find time to really participate in the health equity work group that launched recently. I find that work to be amazing. Annette is just an incredible leader. I'm kind of jealous of how quickly she's been able to get that group to work on really meaningful things. So if I had more time to spend, that's where I'd want to spend it. I've been able to help review a couple of things coming out of that work group, and it's something I care deeply about, and I'm just so proud of the Academy and actuaries as a profession to come together around that issue. I think it's an important one for us to do some self-reflection on our role in terms of health equity as actuaries, and how we can look ahead to the future.
That's great. Yeah, you mentioned Annette James. We spoke to her a few months ago on this podcast, and yes, she that was a great conversation we had. I want to switch focus a little bit now, because actuaries, from my experience working at the Academy for more than 5 years, love to talk about ethical conundrums and ethical challenges. So I was wondering, have you had any ethical challenges or professional challenges that you'd like to discuss, and how you figured out what to do? I imagine you're looking at simple problems in a deep manner might have helped, but
Ethical challenges. I think I've been in. So I was engaged in rate review when I was at the DOI, and in my role in Medicaid now, I oversee our capitation rate setting process with our managed care organizations, and so I've been engaged in a number of contentious discussions. I don't know that they're necessarily ethical conundrums, but challenging situations to work through. And, I found that it's really helpful to develop real concrete guiding principles in terms of decision making and framing discussions. So, we're in the middle of a COVID pandemic right now, and our number one priority at Medicaid is to support our beneficiaries, to support our provider community, to make sure that we're supporting public health initiatives so we can get out of this mess, and that everything that we do and every dollar that we spend demonstrates good stewardship of taxpayer money, brings value to the state and the people that we serve. And So to really bring everything back to those core elements, I find to be really helpful. And when you tell people this is what guides my decision without getting into the details of the decision, I think it helps bring an understanding of your perspective. And so that's the frame that when I get stuck on things, I kind of go back to the core of what is it that what is the problem that we're trying to solve? And what is the end outcome that we're looking for? What do we want to happen at the end, rather than get caught up in some of the details that don't necessarily get you to the end point?
That sounds like a very positive approach, and one that I think I'm sure a lot of people appreciate. I want to move on now to the future, because there are certainly some challenges ahead in the healthcare world, as well as the actuarial profession more generally. Are there any particular ones that you'd like to highlight that you think that need attention being paid to them?
So the system is changing very quickly. We have the passage of the American Rescue Plan, and it really is a game changer in a lot of ways in the healthcare space, at least from where I'm sitting in the Medicaid space, and thinking about our very large uninsured population in North Carolina, and what this means, and our public health response, what it all means. So I think it is challenging to keep up with these changes. I think we all know how challenging the healthcare system is. That's why I work in it, because it's challenging, it's dynamic. But we know that, there's just a lot of, I call it, the squeezing of the balloon. If you squeeze one place, it's going to pop out somewhere else. And so making sure that all these changes are still aligning with what the outcomes are that we want, I think is challenging, rather than it being a money grab. And so one thing I learned in graduate school was the acronym SEI, someone else's income. So every decision you make in healthcare, it's not just, it's someone's health, but it's also every dollar is somebody's income, right? Whether it's a health plan or a provider or what be it. So it's just challenging to keep everything aligned. I think, in terms of the profession, I would urge that, and a lot of actuaries do this already, but just don't forget to look beyond the numbers. Behind every dollar is an important benefit to a member or income to a provider, like I said. And so what do the decisions and the work of actuaries mean for those individuals and their businesses and the community at large? Remember the member, that's who we're serving. And thinking about, again, these decisions is really important. I think one of the really eye-opening things that, or experiences that I had, was after working at the Department of Insurance on all the ACA stuff, I decided to volunteer as a navigator to help people enroll in marketplace coverage and go through that process. And boy, did it look different on the other side. I had seen every piece, every document, rate, filing, benefit package that went to DOI to be approved. But when it came to what it looked like on the website, it was not what I was expecting at all. And sitting with a person talking about their healthcare options and just learning the situation that they were in, and that there was no way that you could convince them that being in a silver plan with cost sharing reductions, even though it was a slightly higher premium, was better for them, because it was about their premium. $20 a month is a big deal to some people. And at least, until sitting down with someone to go through that process, it just hadn't even really occurred to me. And so I think, for actuaries to have those experiences, to see what it looks like on the other side to the real end user, is just an amazing experience that helps reframe the work. So I encourage folks to do that. I think, there are so many ways that actuaries can contribute in the healthcare space right now. Public health, I think, has probably lacked from an actuarial focus, both in helping them express the value that they bring to the system and thinking about them as part of the system and how critical they are. I think this pandemic has really shed a light on that. The health equity space, I think there are a lot of opportunities in there. North Carolina Medicaid, we have a big focus on health equity, and related to that is social determinants of health. So our secretary in North Carolina talks about buying health, not buying healthcare. So we want to buy health. We want every dollar we spend to bring health, not more services. So sometimes that may be a food box instead of a doctor's appointment. So really looking beyond the walls of what the medical profession can provide to buy health is an important area, and it's evolving quickly. And I think actuaries should, and some are, but should think about how that plays into their work. Value-based purchasing, I think all of those things really tie together. How can we incentivize everyone throughout the system to be working towards the same goals, to promote health equity, to support value over volume? And so I think actuaries have a lot to do in that space. And I think actuaries have a lot to gain too by engaging in this really multidisciplinary work and hearing the perspectives of other professionals who are thinking about and tackling similar problems, but from a different perspective. So I do see just a lot of really cool opportunities for actuaries in the healthcare and health policy space.
Your volunteer work as a navigator is one that is needed countrywide. I see it firsthand here in Washington, D.C., where many do not have access to computers or the internet. And with public libraries closed for so long, that became an even bigger challenge. I hesitate to ask this because it sounds like you're kind of busy, but I'm just wondering, what do you do for fun? What do you do in your spare time, if you have any?
Well, I do have a family, so I have a very supportive husband who handles, even though he also has a full-time job, helps a lot with supporting our kids through their activities. But I enjoy yoga from time to time. I live in North Carolina, where we have beautiful weather for much of the year, so I like to get out and walk. Every once in a while, we can convince the kids to go out for a hike, and I enjoy that too. I like being outside, but it is hard to find the time. So that's really it. I don't have a lot of hobbies. I'm super passionate about my work, and I want to do well by the people of North Carolina that I serve. And so it's important to try to keep up with the constant evolution of healthcare here in North Carolina and really across the country. So, yeah.
I'll reiterate what you say about North Carolina. When we are discussing vacation destinations, Asheville is always top of my list. I envy your living there and wish you luck in getting out more often. Julia, I very much appreciate your time today. Thank you so much. I really enjoyed this conversation.
No, I've really enjoyed this, David. I hope folks who are listening are, encouraged to try new things, interact with other non-actuaries on healthcare issues if you're a healthcare actuary, or other issues if you're into other types of actuarial work, and just gain from those differing perspectives. I think it's really important. And folks can find me on the directory if you have any questions, and public service too. I'll put in a plug for public service. So it is rewarding. I would maybe encourage more mid-level actuaries to consider it. I don't know that it's necessarily the best place for new actuaries to be starting their careers, because they tend to, I would find it challenging to set up a training program for a new budding actuary. But there's really so many rewarding things. I think in North Carolina Medicaid, in my position, I call it, an overwhelming number of opportunities to contribute. It's really overwhelming, the number of ways to contribute in public service. There are a ton of great, smart, dedicated people in public service, but probably not enough actuaries.
Well, Julia, thank you very much. As I said, it's a fascinating conversation. I appreciate you taking the time, and I doubly appreciate your commitment to public service. It is certainly something that we could all aspire to. Thank you.
Thank you, David.
Thank you for listening to Actuary Voices, the podcast from the American Academy of Actuaries. My name is David Nolan. You can subscribe to Actuary Voices wherever you get your podcasts. See you next time.